My name's Kevin Street. I'm a former client here of the Medically Supervised Injection Centre. This centre saved lives. It's been open for 21 years and not one single person has died. If you looked at what was going on around King's Cross before this place was open, there were ambulance call-out all over the place. People were dying from drug overdoses because they're going to inject their drugs regardless of, where they are. So this gives them a clean, safe place to do it, clean equipment and intervention if there's any sign of overdose whatsoever. If I hadn't walked in that day and asked for treatment and been given such a service that I was, I'd probably still be coming here to inject.
This is my laneway next to my house that used to be filled with people injecting and overdosing on a daily basis. The laneway was filled with ambulances and paramedics resuscitating people, and we couldn't get in and out of our homes because of the tragedy of human beings collapsing from heroin overdose. Since our supervised facility opened, this has changed completely. You can see this is my empty laneway, and other laneways around Richmond are the same. We don't have people dying in our streets like we used to. We don't have precious emergency services vehicles and paramedics having to deal with human beings collapsed. Traders in the main street prefer it as well. They don't have to stop making coffees for people to go and ring emergency services. The people who use our facility in Richmond love it. It's opened opportunities for them to reimagine their lives. It is a wonderful thing that's happened to us.
My name's Mary Tomsick. I live in North Richmond, around the corner from the Medically Supervised Injecting Room, and I'm really pleased that we have this facility in our community. I have two teenagers who were in grade 3 when the facility first opened. They were then at the school next door. This didn't have any poor impacts on them at all. And I'm really glad that that facility is there to support people at whatever stage of their life to get the support that they need.
A medically supervised injecting room is not a silver bullet, but it's a start. And what we've seen around these places is a much more civilised and humane environment, a place where people now have options, and it's a place where the community, the residents of South Abbotsford and North Richmond can begin to reclaim their neighbourhood in a way that is inclusive and is sharing with people of all sorts, regardless of their background, regardless of their current condition. It's just something that's needed. It's a health solution.
Hello, I'm Maxine Davis, Executive Director at the Dr. Peters Centre in Vancouver's downtown West End neighbourhood. The West End Business Improvement Association says, in our experience, we have no issues with the services provided. It is better for our trading area to have individuals supervised rather than being sent out of the centre with sterile needles with the possibility they will publicly inject. And from the West End Residents Association, without a doubt, the service provided by the Dr. Peters Centre are vital and necessary to our community. From the Mole Hill Community Housing Society, in addition to bringing individuals into care, it means Dr. Peters Centre clients have an alternative to injecting publicly in the neighbourhood.
My husband and I and the rest of the family lost our son, Kevin, to an overdose of heroin. He was in a locked toilet in the centre of town in Marks and Spencer's in Carmarthen, near where we live. If there'd been an overdose prevention centre, somewhere safe for him to have gone, to use his drugs in a safe environment and under supervised conditions, he would certainly be alive today.